So in pregnant women, we have one very, very special vascular bed where our blood interacts with the fetal blood supply at the placental surface. So we want to know, how does coronavirus affect that vascular bed and the baby that is growing inside of there? So kind of two things to think about. One is the topic of vertical transmission. So there are some viruses, when we have them as pregnant people, we experience them, but it really can't get through that door to affect the baby. Things like the flu, we don't think that flu crosses the placenta at all. Now, will the maternal health have an impact on child health in the flu? A mild case is mild, a more severe case may have outcomes, sure. But we don't think it crosses. And that's compared to some other viruses that do cross, things like CMV, rubella, some of the infections we care about in pregnancy and try to prevent in pregnant women. So the question is, does this virus cross? And why that matters is because it can have different effects during different times of gestation. So some viruses, when they happen very early in pregnancy, things like the Zika virus, they can cause birth defects. Things like microcephaly is the big thing associated with Zika, and some like intellectual disability. Later in pregnancy, those changes are less likely because the baby is formed more completely, and so it's not really a birth defect. But then can an more formed baby in the third trimester have negative effects from a virus? So for COVID, the baby doesn't need lungs at all. It is totally subsisting off of your circulation, does not need to exchange oxygen on its own at all. But would it affect like vascular disease, et cetera, et cetera? Then the second really important part is, will the baby be healthy at delivery? If the transmission is via the placenta versus to a positive mother. I think this is a little less important. Let's just say you get COVID when you're 38 weeks and then you deliver the next week, you're still symptomatic. Since we're not doing, I don't think really anywhere is doing, although I'm not sure of certainly every single labor and delivery in the country, but I haven't heard much anymore about separation. So if we're not going to separate the mom and the baby, does it really matter if the baby gets it through the placenta or gets it through interacting with the mom? I mean, all moms are going to try to do the best hygiene they can to prevent infecting their baby, but it becomes a little bit less important. So we're really worried about the early and the birth defects.